Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗥𝗲𝗹𝗆 as we discuss the latest health and medical topics with doctors from 𝗥𝗲𝗹𝗆. For a healthier and uplifting lifestyle, tune into Healthline with 𝗥𝗲𝗹𝗆 on 𝗛𝗲𝗃 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗥𝗲𝗹𝗆 every Monday from 5 p.m. to 6:30 p.m. airing on Sky Cable Channel 224 and on all DTT boxes, simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search 𝗛𝗲𝗃 Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗥𝗲𝗹𝗆 interact with you for a healthy, uplifting lifestyle, moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗥𝗲𝗹𝗆. I hope all of you are doing okay here in Metro Manila, where we are broadcasting from. It's a bit gloomy. It's a bit of a gloomy and rainy afternoon, and we've heard the news about two major volcanoes in the country that are currently active or erupting. But, there's always also good news, and this show is here to bring you help and tips to help you have a healthier, uplifting lifestyle, things you can do on your own. And of course, we get the information straight from our experts who are doctors, practicing doctors in the prestigious Makati Medical Center. So today, our topic is going to be scoliosis. You may ask, what is scoliosis? Well, we'll ask the doctor himself. Welcome to the show, Dr. Bruce Canto. You are an orthopedic spine surgeon, and I want to thank you, first of all, for giving us some of your precious time and your knowledge and information to talk about scoliosis, which I'm betting so many of us have, no? Not just Filipinos, but so many people around the world. So to start off, to kick off, let's jump right into it. Can you tell us, doctor, what exactly is scoliosis?
So good evening, Nicole, and good evening,
good evening, yeah.
Listeners and viewers. So scoliosis, you hear this a lot, no? Scoliosis is actually it's a three-dimensional abnormality of the spine, wherein your spine actually curves to the side and also rotates, no? Rotates a bit. So it causes a bit of asymmetry sa spine. When you talk about scoliosis, there are actually two main types, or two the most common types. The first or most common type is the one we call idiopathic. This is the one that we usually see in the teenagers and the adolescents. No, when you say idiopathic, that means there's really no known cause. No, I get the questions a lot. They ask me kasi parang, Doc, namamana ba ito? Is it something that you pass on from parent to child? No, when you say idiopathic, talagang idiopathic. No, we don't know really what's the cause. No, parents with normal spines can have children with scoliosis. No, the other type that's also very common that I think is relevant to our discussion today as well is what we call the adult degenerative type.
Okay.
These kinds of scoliosis naman are the ones that, as we get older, as you age, no, and then parang the joints of the spine aren't able to support the weight of the upper body in a well-balanced manner. No, the discs will degenerate asymmetrically. So parang naka-curve yung spine habang tumatanda yung pasyente. Yun yung other type na degenerative naman ang tawag doon. So those are the two things I think that, well, of course there are other types, no, but
Yes.
Those are very rare naman that we seldom see also. So yun.
Yes. Okay, so the two types, doctor. Thank you for explaining that to us. And I'm interested because you said it's a three-dimensional thing. So should we
Yes.
imagine that the spine, because we say, okay, scoliosis, you hear your spine curved, but you also said it rotates.
Yes.
So if I were to imagine,
Yes.
let's say something straight, no? And for those who are viewing, if you can see this ball pen, it doesn't only like curve, like it also rotates. So that is something that maybe people should know about to take it more seriously. No, that
Yeah. So if you see me, for example, my shoulders like this, no.
Yes.
So when I say curve, it curves this way.
Okay.
And then it doesn't only curve, it rotates, so it twists like this.
Okay, it twists.
So
Yeah.
patients, so nagro-rotate. So patients with scoliosis, sometimes when they bend forward like that, that's actually one of our tests, no? Hindi lang siya curve ng ganon, parang there's a rib hump, parang umaangat yung upper back niya kasi it's rotated either clockwise or counterclockwise.
Can it
So,
also... Okay, so thank you, doctor. When you talk about the first type of scoliosis that is most common, the idiopathic, as you said, people ask you, "Namana ba to? No, is this genetic? Did I get it from my parents?" But you said you really don't know where it comes from. Could it be that, let's say you have one patient and you mostly see it in teenagers who start coming to you because they have back pain or they exhibit signs.
yes.
Let's say there's one. Because I have heard that yung scoliosis, it runs in the family. Okay, I've heard comments like that from people. Let's say there's a teenager who comes to you, let's say a female, maybe 17, 18 years old, and then like one of her aunts, not her parents, but her aunts also has scoliosis. How do you explain to them that you can't really say that it runs in your family or that it's genetic, even though maybe other members of the family have it also? Like
Sige. So when I said we can't really say, it doesn't mean kasi there are studies that show that there are genetic factors really, no?
Okay.
So for example, like you said, no, that's very true. It's very common na minsan I have patients na magkapatid, no, siblings, they both have scoliosis, no? And then you ask, did the parents have, yun pala, exactly, no, yung auntie niya may scoliosis din, or yung grandmother niya may scoliosis din. That's correct, no? So there are genetic factors pa din at play, no? But it's very hard to really give a concrete or give concrete evidence kasi even the research, they have not been able to identify the specific genes which cause this kind of type, no? So it's also very to say na parang the likelihood pag may scoliosis yung father, magkaka-scoliosis yung anak. Very hard din to predict that So
you're being responsible when you say na we can't say na namana mo yan or that that your child will get it too. Because
that's right. So may genetic factors, meron pa rin, pero mahirap sabihin na most likely magkaka-scoliosis yung anak niya kasi may scoliosis. Kasi wala pa ring evidence na talagang gano'n, no? Walang concrete proof talaga.
Kasi when you mention scoliosis, and a lot of people, or they say I have scoliosis or I was diagnosed with it, baka nga mamana ng anak namin. They say things like stuff I mentioned, and they say no, for sure it's in the family. Pero the thing there is really you're relying on concrete science and research na you cannot identify the gene that they haven't, that passes down scoliosis. So sure, there are genetic factors, pero you can't really say na minana mo yan. Para walang blame sa either.
That's right.
Okay. Thank you, Doctor.
Walang sisihan.
Walang sisihan. Right. Thank you, Doctor, for making that clear.
Walang sisihan yung tita mo ko yung
dahil sa tita ko yan ako. Because I've heard a lot of that. Siya kasi, meron din siya. Siguro naman ako sa kanya. So at least, we know that it's clear that based on the studies now and the science and the latest na you could get it from anything. You don't know what causes it. Okay. And then doctor, just to talk a little bit more about the second type of scoliosis, the adult degenerative type. Can you tell us, or even the first, can you tell us, are there demographics where you find out that there's they have idiopathic scoliosis? Is it like more male or female, and or what age, or and then also let's go to the degenerative scoliosis after that and talk about do you find that there are this group of people is more likely to have it as compared to another in your experience?
In terms of prevalence, so let's talk about idiopathic first. In terms of prevalence, most meta-analysis will show you that there is more common in females than in males. No, the ages range between 9 to 15 years old, but that's when it's detected. So that's when they show up, diba? So yun yung numbers natin. Idiopathic scoliosis, out of all the other types, it's about 65 to 70%. Encompasses 65 to 70% of all the scoliosis cases. No? When you talk about degenerative, parang iba naman to. Ito yung mga more common sa ages 50 to 65, no?
50 to
And these are the ones na talagang risk factors for this: advancing age, of course, also sedentary yung lifestyle nila, weak bone quality, pag medyo heavy on the heavy side yung pasyente, no, yung body mass o yung body weight niya mabigat. Yung prevalence niya nasa 13 to 68%, very varied, no, but they have a range of 30%. So like I said, no, kung yung dalawang type yung pinaka-common, yun nga, they encompass most of the scoliosis cases.
Yes. The idiopathic scoliosis encompasses most of the cases of scoliosis, and then the degenerative is maybe the age range you were saying is about 50 to 65. Anything older than that? Have you seen people?
Yeah.
Okay, and there are many factors risk factors, like if they're on the heavier side, or you said low bone quality or something like that. Parang the bone quality is not as good, and those things come with age, doctor. Okay. Are there any cases where it does it come because of lifting, hard work, or maybe you want to circle back to that later? Like, well, you did say sedentary lifestyle for degenerative scoliosis, but
we can circle back if you like. Yeah.
Okay, let's circle back.
It's okay. We can circle back to that.
We can circle back because people will have how do you say this? An idea of, oh, it's because you lifted too many. You know, you always hear that, and maybe that's not how it is. That's
right.
Why we're here to get you to inform us. So, doctor, what are the common signs of scoliosis in a patient?
So the most obvious sign with scoliosis, usually, kasi scoliosis is identified really by X-ray, right?
Yes.
We measure there's a lateral curvature of the spine, and then we have what we call a Cobb angle, meaning we draw two lines. It's a little technical. We draw two lines from the top of the angle and from the bottom of the angle, and then when they intersect, they form a degree, no? Okay. So anything that is 10 degrees above is already considered scoliosis. So let's say there are a lot of these patients na alam mo yung mga physical exam, yung mga clearance sa trabaho, sa work clearance, physical clearance, and all that. They get chest x-rays and all that. And then may discovery na yung spine, you know, incidentally, yung spine nila may curve, di ba?
When you take chest x-ray, oh, parang may curve.
Yeah, may curve. So, ganon. So, pag may curve na 10 degrees yan, sige. So, let's classify the scoliosis already. So, hindi siya detectable usually when it's very, very small, like between 10 and 20 degrees lang. Kaya dun lang nahuhuli, di ba? These incidental findings lang on chest x-ray. But when it goes, let's say, above 20, above 25 degrees or so, medyo nagiging halata na ng konti, no? Okay. Either for young kids, for young patients, no? Pag idiopathic, pag adolescent, minsan yung bagsak ng t-shirt, iba na yung itsura, di ba? Minsan meron konting shoulder asymmetry. Sometimes it's like that. Sometimes yung minsan magsiswimming, for example, nung summer, nag-beach outing sila, makikita mo yung shoulder blade sa isang side mas prominent, no? So these are the initial signs you can see.
Parang mas mataba yung isa or yung blade.
That's right. Minsan mas kapa yung isa and stuff like that. So those are initial signs. When you get to more severe curves, no, usually these are above 50 already. That's when other symptoms start to come to play, no? Kasi pag mas malaki ang curve, mas malaki yung imbalance, no? So, nagkakaroon minsan ng back pain. Ayan, no? Scoliosis per se, I think I'll address this now, no? Scoliosis per se, kasi very, very common ang thinking ng mga pasyente. Automatic, pag may scoliosis ka, masakit ang likod mo, no?
Yes.
It is not necessarily the case. Again, if we go back to the literature, if we go back to the research, it is still very controversial, no? The curve per se doesn't cause any pain. Kahit anong kapa-kapa mo sa curve ng spine, hindi masakit. It's non-tender. There are patients with very, very severe curves, but they don't have any pain whatsoever. You know what I mean?
They don't have any pain. Okay.
They're very, very comfortable. They can tolerate sitting for a prolonged period of time. They can, you know, for example, si Usain Bolt, di ba? Si yung 8-time Olympic gold medalist. He has a scoliosis curve of 40 degrees, di ba?
Wow.
But you don't see him, you know what I mean? He's an
Yeah, he can perform as an athlete. You don't see him
That's
like
right.
dying of
That's
pain,
right.
which you would think that if it's 40 degrees or more,
Yes.
that he's in so much pain already. How can he tolerate that?
That's right.
So this,
That's
I'm
right.
glad.
So,
Doctor, for this. Go ahead. Sorry.
yeah. So in terms of the pain, I think to explain it, it's more of really the classic reason why we have back pain is really the poor posture, the prolonged sitting. You know, this affects everyone, no? But we can say that maybe it affects more severely the patients with severe scoliosis because there's a trunk imbalance. So the muscles that are trying to compensate, hirap sila, right? But to say that automatically if you have scoliosis, you have back pain, that's still controversial. I don't think that's really set in stone also. So
I'm so glad you said that, doctor, because okay, so just a recap, and this is my understanding. Please jump in and correct me anytime
yes.
if I'm wrong. So what I'm getting from what you just said is that when you have scoliosis, first of all, to detect it, you might not even know. Because first, it doesn't automatically mean that you have back pain, no? And then it's sometimes it's an incidental.
Yeah, for small curves, no? For small curves, hindi nakikita masyado. Yeah.
And then there are signs or symptoms where you can see that it maybe physically, no? And you were talking about, maybe the shoulder blade is too pronounced in when you see teenagers swimming, it's summer and all of these things. But having back pain doesn't automatically mean you have scoliosis, so you shouldn't panic about that. But of course, later, the other reasons for treating scoliosis, I'm sure you'll get to that because I guess it's a structural thing, no? And as you were saying, the way we are, like the way we live, I mean, this is the way we live our lives today. If we have prolonged sitting, maybe working on computers or doing anything like that, whatever our activities are, everyone can get back pain for a number of reasons. But for those with scoliosis, it might affect them more, and that's maybe they'll only start noticing, baka I have something, it always hurts because of the structural problem there that scoliosis renders.
The imbalance.
The imbalance.
Yeah, the trunk imbalance is the one that predilects them to having. Yeah. Tama.
So it parang it affects the muscles and all of that, and that's when nahihirapan na because there's something about the spine that is not correct, and that is the scoliosis. Yes. Tama po, doctor. Para maintindihan, para alam ko na naintindihan ko and our viewers out there na hindi automatically pag masakit ang likod mo may scoliosis ka na, or hindi naman automatically na may scoliosis ka.
Or vice versa. Or automatic kung may scoliosis ka, sabihin may kaka-back pain ka. Yeah.
Okay. So and later I'm sure you'll tell us why is it important to address it kung hindi ko naman maramdaman yung back pain. Syempre, we'll tell you why, in a bit throughout the conversation. But before we get to that, I wanted to ask you, doctor, what are the tests, or is there new equipment or new things? What's available in Makati Med for to detect scoliosis, like the diagnostic test that you use, from everything that you do, like when you test a patient, when you suspect someone has scoliosis? Can you tell us about that?
Sure. So scoliosis is diagnosed initially by inspection, like I mentioned earlier. When you look at the child or the patient, if you have asymmetry, if you have there's a test called Adam's forward bending test, no? When you ask the patient to bend forward and then you see there's a rib hump or mas angat yung isang shoulder sa kabila, that's usually a positive test, no? We also have what we call this small contraption. It's called a scoliometer. So habang yung pasyente nakayuko, bent down like that, you put it on the pinaka center of the shoulder or the shoulder blade, and it measures how much tilt or how much rotation the patient has. Okay. Scoliosis classically is really just all about getting really good x-rays, no? whole spine x-rays, like the ones that come usually clinic na nagka-check up noon sa nagka-chest x-ray. Doc, paano ba yan? Pwede nung sukatin. That's not enough. To really evaluate the scoliosis, we need what we call 36-inch films, no? Yung buong, kumbaga yung litrato, yung buong spine, kuhang-kuha.
And
yeah,
like,
and Makati Med has able to provide with that, no? Yung buong film na malalaki, it's called a 𝗠𝗸𝗁. And then we also have those bending films as well. So parang meron na tayong package na we call Scolio series. So meron tayong front, yung AP view, meron tayong lateral, yung kuha ng x-ray sa side view, and then merong bending to see kung flexible yung curves, no? So usually yun ang naman ang initial tests natin for scoliosis.
So doctor, if a patient comes to you and, or let's say they had a chest x-ray and then, oh, incidentally, something looks, something doesn't look that great with your spine, and then they have these other factors and they suspect they have scoliosis, and then so they can come to you, and there's a physical examination talaga. There's a part where you check up their spine, you make them bend, and then you even have this
scoliometer,
scoliometer where you put it on their scoliometer, where you put it on their shoulder blades so that you can tell, okay, something's uneven here. Or it's not straight. And then you said there's a scolio series, a package. It consists of getting good x-rays. That's what you said. Because maybe, if somebody says, I'll just go get a back x-ray somewhere else and bring it to my doctor in Makati Med, no? It would really be best to use the facilities of a place like Makati Med, where you get what you need, which is the 36 meter film, and you really see the whole spine, and you see it from every angle. It's not naman a scary test. I'm sure when you get an x-ray, you're just told to either lie down or stand there in a certain position, and then they take the pictures. But you have the equipment, the best equipment, to be able to really diagnose the scoliosis, the degree, and maybe make a plan of treatment or management. So So the equipment is also very important. Hindi lang pwede yung basta-basta magpapa-x-ray ka. Okay, you might get a sense of it, pero it's not going to give you the best indication or the best results or all the facts that a doctor like yourself would need to really treat a patient properly. Okay, so I would advise someone with scoliosis to go to a place like Makati Med, where you can really get everything you need, to be able to test it.
Yes.
Not just like a plain x-ray from somewhere. I mean, yes, plain x-rays help, but they're not gonna give you as much information as a doctor should have to treat your scoliosis. Okay, so doctor, so when you treat scoliosis, I mean, why should it be treated if there's no pain?
So again, let me categorize the scoliosis that doesn't come with pain are the ones that are very, very mild. Sometimes moderate in severe cases do not come with pain. So it's not really the pain per se that is the reason why we treat. When it comes to idiopathic, it is we don't want the curve to keep getting bigger. So our treatment is to make sure that the curve doesn't progress to a certain degree wherein even though the patient, again, with idiopathic, even though the patient reaches skeletal maturity, ibig sabihin, hindi na siya tumatangkad masyado or yung bones nagiging rigid na. Kasi if you pass a certain amount of degree, even though the patient is older, we know na lumalaki-laki pa rin yung curve. And the problem with really big curves is that when they reach a certain amount, let's say, for example, and curve na maliit nagsimula ng 25 degrees lang, very mild, very young, napabayaan, hindi nag-check up and all that. And then this patient goes through a growth spurt, yung biglang tangkad. Siyempre yung biglang tangkad ng pasyente dahil may curve, sinusundan niya yung curve. Yung
lalong bumaluktot.
Exactly. So may tendency na lalong bumabaluktot. At pag umabot tayo sa lampas 50 degrees, that becomes already the borderlines or the how do I say this? Kapag alam namin lampas 50 degrees, baka lalong lumala pa, no matter what age the patient is. And when you reach around 70 degrees, no, at 70 degrees, it's already proven na yung respiratory function, yung paghinga ng pasyente, apektado na. Kapag umabot ng 90 to 100, pati yung heart chambers or yung cardiac area where the heart is, naiipit na, no? So, essentially, yung lifespan ng pasyente, kapag umabot ng ganun ka-severe yung curves natin, nag-shorten. That's why it's very important that we catch these cases early, habang maliit pa yung curvature, habang very young pa, so that we can prevent the curves from getting worse. And then we can talk about it. We're going to go about it later na parang the ways and means how to treat scoliosis, no? But the goal is really to prevent the curve from reaching really high high magnitude, which will affect yung lifespan ng pasyente.
So ultimately, that's it, no? Because a lot of people say, well, it doesn't hurt anyway. It's only like 10 degrees or 20. I don't feel much of a difference. But especially if that patient is still growing, the goal is to prevent it, the curve from getting worse.
Yes.
Because at some point, if it gets worse, you may not feel back pain, but it starts affecting your other organs. You mentioned like it starts
That's
affecting your ability to breathe, your heart, because your back is crooked in that upper area. And scoliosis is only the upper back. It has nothing to do with the lower back. Just to the scoliosis
again, pag degenerate depends eh. The curve can be on the lower back. Hirap, no? The curve can be on the lower back naman.
Other functions naman.
For degenerative types of scoliosis naman, more commonly nasa lower back yung curve nila kasi dun yung high area of stress kapag tumatanda, no? Walang ribs sa lower back. It's just really a very flexible part of the spine. So doon nagiging curve doon naglalagay ng scoliosis yung curve niya. But yeah, you're right, no? On idiopathic naman, pwede rin sa lower back, depending on the location. But on lower back naman, ang nangyayari yung balance ng pasyente, nagiging significantly affected also. So whether it affects the upper region of the spine, and then it can compromise your breathing and your cardiac output and your or the lower part of the spine, where it affects your balance. It's just that talagang kailangan mahabol natin. Kailangan mahinto yung progression niya, no? Kasi whether up or lower, talagang hindi maganda yung result for a very yung mga scoliosis curves na napapabayaan, yung severe deformity, mahirap talaga yung buhay nila ng ganun.
No, yes. I actually know a lot of people who say or who have been diagnosed with scoliosis, but they just don't follow up because they feel the treatment isn't necessary. It's not painful at this time. They're very busy.
Well, generally kasi most curves are really just mild, no? In other words, they don't really reach the point wherein they will need treatment, no? So if a patient reaches skeletal maturity, halimbawa nasa 18, 19, 20 years old na, and then yung curve niya nasa 20 degrees pa rin, no? Very mild pa din, or less than 30, they definitely don't need treatment. So I agree with that, no? The lesser curves, without naman any growth potential anymore, they don't really need significant treatment. So tama naman yun. But the important thing is kasi the reason why you consult when you have scoliosis is our job is to tell you if it is going to progress or not. Kasi may mga classification yan eh. So, may scoliosis ka, mild nga, so that's good. Good for you. May mga pasyente na may scoliosis, pero yung simula pa lang, nasa 35, 40 na. Diba? So, pag 40 degrees na, tapos very young pa, malaki pa yung growth potential niya, we can already more or less predict na it will get worse as they grow older without any interventions. So, again, no, mahirap mag-generalize na, pag may scoliosis ka, you need treatment. Not necessarily as well. We have to determine first talaga the degree of the curve. Of course, the age is also a factor. Kahit sa degenerative, kahit sa mga older patients with degenerative scoliosis, not everybody has back pain, not everybody has symptoms I have patients with really, really severe scoliosis, degenerative, but they're fine. No? They're very, very active. So it all depends on, it's case to case. It's very, very hard to just generalize and say that scoliosis needs treatment, or it always needs treatment, or always needs, let's say, like this. Mahirap talaga sabihin. But
That's why patients should go to you, and other doctors like you, to see what they should be doing about it. No? Or
that's right. So it's about determining first kung may scoliosis ka, kailangan malaman natin kung mag-progress pa to o hindi. Or is it the reason for your pain or something like that. So
you mentioned yeah, you mentioned that's important though, because you might if you're a patient with scoliosis, you might just keep going, and there were things that you could have done to prevent the degeneration of the curve. So I think it's very important to remind people, especially those those who have been diagnosed before and have kind of like, well, it's okay, or I haven't gone for a while, or like I haven't gone in 20 years to see a doctor about scoliosis. You should check on it. I mean, it might be fine, and that's good news, but there are other things you can do to help with your scoliosis, because eventually, if it's degenerative, it can get in the way of your breathing, all of these other issues. And as you said, the ultimate thing here is you're trying to lengthen the lifespan, because scoliosis can lead to a point where it shortens the lifespan of the patient. And doctor, you mentioned some activity, so I have to ask you, like, those you said you have patients who have maybe 50 degrees, but they're very active. There's also this, a lot. I guess it's for non-medical professionals like us, or people not very familiar and not really into managing their condition of scoliosis. We are told you shouldn't do this, or you shouldn't do that, or you should only swim. Oh, don't run. It's bad for you. Don't play golf. Don't play tennis. Don't do martial arts. We hear all of these do's and don'ts. When you have scoliosis, I mean, one question is, do the physical things you do really affect your scoliosis? Can it make it worse? I mean, of course, it's a case-to-case basis, but maybe you can give us one example where it affects you. And the other one is, when you have scoliosis, what can you do? And what are the things that you can do? What can't you do, and what can you do physically?
Okay, so we'll differentiate again between differentiate again between idiopathic, the one we find in teenagers, the adolescent idiopathic type, and very different also yung degenerative type. No, so for the younger patients who have the idiopathic scoliosis, there is not much restriction. No, I always tell those patients of mine na wala namang talagang bawal. You can participate in sports, you can do, kasi sometimes ang tanong sa akin, Doc, pwede ba mag-PE? Pwede bang mag-basketball? Pwede bang mag-swimming? Pwede bang all sorts of activities, no? I said, there's nothing, walang bawal. Yes. These activities of yours will not really affect significantly the natural history or the course of your curvature, no? Yung curve ng spine nyo. So kung gusto mo mag-sports, mag-bike, all these other activities, mag-basketball or mag-volleyball, mag-ballet and all this stuff, it's not restricted for them. Restricted, okay. What I restrict is not really necessarily because of the curve progression. Ang nire-restrict ko, which is an advice to go, which is my advice to what goes to everybody, is yung sitting and yung posture para hindi sumakit yung likod. Yun lang. No? This applies to everyone talaga. So no restrictions kahit may scoliosis. Even for curves that are very, very severe, minsan limitado na yung movement nila. Sila mismo, the configuration already limits their ability. No? So hindi siya may pinagbabawal ka. It's just their condition already limits them to really participate. No? That's why we want to prevent that from happening. Okay. So sa degenerative naman, iba naman ang storya. Kasi sa degenerative scoliosis, kaya nagkaganyan kasi mahina yung likod nila. Yeah. Kasi mahina yung likod nila, unang-una, partly aging. Again, partly nobody can avoid that. Unfortunately, that's part of life. very sad, no? Na aging, hindi na alagaan yung spine. And the way the spine ages that leads to scoliosis is yung discs natin in between the bones, no? Nagiging flat, no? Nagda-dry up, nagiging flat. And sometimes yung pagiging flat niya, hindi pantay. Sometimes it flatter on one side than the other. So this is what we call asymmetric degeneration, no?
Is that
Pag
related
ganyan
to slip
nangyari,
discs? Like, is that related to slip disc?
yes, that's related to slip disc. Yes. Oo, related yan. Very related yun.
Just
So
related.
kapag ganyan, kapag mahina na yung likod kasi hindi na support yung upper body, definitely you cannot lift weights, di ba? Hindi ka pwedeng araw-araw nagbubuhat. Halimbawa, bodybuilder ka, meron kang degenerative scoliosis, the advice would be to stop. You know what I mean? Kasi it will worsen your symptoms, di ba? Or hindi naman stop, but to limit, di ba?
To limit, yes.
Golf is actually, wala naman tayong ano sa golf so much, no? It's more of just the bending down and it's
But
really
it's
about core strength. Moving the head, it's all about core strength talaga. So kung mahina yung core niya, sumasakit yung likod niya, you know, hindi rin siya makakapaglaro masyado, you know what I mean? So it's really dependent on the type of scoliosis. It's really dependent on the cause of the scoliosis. It's also dependent on the symptoms of the patient. There are patients with scoliosis na degenerative na they have sciatica, no? Because nga may slip disc na kasama, diba? So ganun ang problema. So limitado rin sila on the things that they can do. So it's very hard. I understand it's very hard to generalize.
Yes, yeah, we can't generalize. But basically,
That's why I spend a good amount of time really explaining to the patients na ganito yon. These are the things you can do and can't do. So
and it's individualized treatment that you give.
That's right. That's right. Yes.
I'd like to highlight that because we get a lot of information, or we trade information in the sense that I have scoliosis. Oh yeah, me too. That's why I don't play golf. Oh, but golf is supposed to be good for it. No, you're not supposed to run. You know, we have all this. We've known about scoliosis
May
for a while.
Argument.
Yes, we've known about scoliosis for a while, but we don't know the newer things that are happening. And that's why I'm so happy that you're here to tell us about it. Like, there is the equipment, you know, before it was just x-ray. I when I was growing up, they said I had scoliosis. I never followed up. I think maybe I should see you. But it's like, you know, yeah, because it was like, oh, okay, just go with it. You know, that was sort of the thing.
Yeah.
But I didn't get like all the back x-rays that you're talking. Sure, it was x-rayed, but it wasn't like with that millimeter of film. You know, I don't remember the thing being put on my shoulder. Like, there's new ways or new diagnostics, and you have the latest diagnostics and equipment. Like, it's not something that where the medical community and research hasn't moved and progressed. There's more knowledge now, and treatment can be individualized. Yeah. And then, okay, I have to ask you,
and there are more ways to treat.
More ways to treat, yes. And before we go on a break and then come back and talk about the ways to treat scoliosis now, can you tell me about C curves and S curves? I used to keep hearing that, oh, your scoliosis is a C curve. Oh, your scoliosis is an S curve. I didn't hear you mention those terms. So is it different now? Is it classified differently, or, you know, what are they exactly?
There is a classification. I think when you say C curve and S curve, it's really just describing the X-ray. It's describing when you say C curve, there's a solitary curve on the thoracic spine, and then dito sa ilalim, relatively diretso na, di ba?
Okay.
So parang
there's
gano'n.
konting outward push, but the rest is straight.
So imagine it, parang diretso, pero curve ng ganyan. So yung letter C niya, nasa thoracic, pero yung lower back, medyo diretso. So that leads the shoulders to tilt this way.
Yes.
Pero yung lower back niya, diretso. So yun ang tinatawag na C curve. Pag sinabing S curve, may curve sa ibabaw, and then may curve sa lumbar. So parang ganon siya.
Looks like
so double curve yun. That's right. So it looks the letter S. So these are the curves na nag-curve sa ibabaw, pero yung curve sa ilalim equal siya So, pantay pa rin yung balikat niya.
Okay. So,
Parang nagko-compensate, di ba, sa ilalim. So, S yung curve niya. So, again, there are many, many different variations to this. We don't usually use that classification, no? Na C curve. No, we have what we call the Lenki classification that's used universally. And this is to help classify. Ang dami kasing parameters yan, no?
Yes,
so,
yes.
location ng curve, and then whether may isang curve, whether it's structural, whether non-structural, whether malambot pa or flexible pa yung isang curve, and then the other curve is not. This is a classification that helps us when we already plan for surgery, no? What curves to treat and what curves not to treat. Yeah, but in terms of the C curve, S curve, yun lang. Parang dinescribe lang yung itsura sa X-ray.
So it's good. My terms are from 30 years ago, from personal experience of others. Like, you also have scoliosis. You also, so what can we do about it? And then to a point where, well, we just had to keep moving, or there's so many. I guess. Me myself also, I've been misinformed. I don't usually talk about myself and whatever illnesses on a program, but I have to say that with this program, like and I have friends watching, because I told them since all of us apparently have or had scoliosis at one point, it's better to learn all the new at one point, because we don't know.
Yeah.
But if somebody just said, because it wasn't really a bone doctor, no, you have scoliosis. Parang, are you sure? How can you have scoliosis at the same time? It's possible, but, we're told not to lift things. So there's many things that there's a lot of maybe misinformation that we still impose on ourselves. And that a lot of people with scoliosis or without scoliosis, think that this is the case. But I'm so happy to be talking to you and saying that, you're saying you have to be treated individually. It's an individualized treatment. You can't just generalize. I mean, you would think something like scoliosis, if you have it, just, do these exercises or whatever it is. And then if it's really bad, go to the doctor and they have to fix your spine, which nobody wants, it's immediately scary, but we'll talk about it. Yeah. But, so we just kind of ignore it and go with the flow, and then when we get some back pain, it's my scoliosis, we all automatically think if it's a certain kind of pain. But as you said, sometimes it's not really the scoliosis that causes the pain. It's the other things we do, and because the scoliosis is structural, our other muscles or bones get tired because of the mistake or the abnormality, in the structure of our spine. And that's what it is. And that's really good to know. So, doctor, we're just going to take a short break. And when we get back, let's talk about, some treatments for scoliosis and other things you'd like to talk about. We're all ears. And I'd also, so when we get back, let's talk about that. We're just going to take a short break and stay tuned, because Dr. Canto is very, very enlightening. When it comes to the subject of scoliosis.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access. Hi, this is Dr. 𝗛𝗶𝘁𝗵 and welcome to Makati Med Wellness Center. Located at Ayala North Exchange, the Makati Med Wellness Center is a warm and comfortable state-of-the-art lifestyle center where executive checkups and services that address holistic patient care and wellness can be done. We have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. The Wellness Center is equipped with modern facilities and staffed with competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services for both adult and pediatric patients alike. This is a great place to prioritize your health and well-being without having to be at the hospital setting. We are open from Monday to Saturday at 7 a.m. to 5 p.m. at the 7th floor of Ayala North Exchange, Tower 1 in Makati City. It is also accessible from the Makati Med Hospital through a bridgeway to Ayala North Exchange. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Wellness Center.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. Today we're talking about scoliosis, and with us we have Dr. Bruce Canto, who is an orthopedic spine surgeon. And we got a comment. I'm surprised to find out that scoliosis doesn't run in the family. Okay, that's a comment that is from Michelle. Thank you, Michelle, for that comment. At least, some of us know that it's idiopathic, means we really don't know where it comes from. And then we have a question or comment from Dina. I have scoliosis, or the doctor told me when I was a teenager, will I have to go to a doctor all my life? Well, I guess, doctor, that's for you. That question is for you. Or what did your doctor tell you, Dina? So maybe it's time for her to get a checkup with someone like you, doctor, or with you, just to see.
Yeah. So again, like we said earlier, if she was diagnosed with scoliosis during her teenage years, it's important pa rin. We always do this. It's important to find out the degree, the measurement of the curve, we also want to see, for example, she has old x-rays that she can bring. We will measure the curvature there, and then we'll take updated x-rays and we will compare, kasi if, let's say, dati maliit lang, 25 degrees lang, and then we take new x-rays and it's the same, 25 degrees pa rin, hindi nag-progress, that means she doesn't have to do anything, live a normal life. No need to see a doctor for the rest of her life, like she mentioned. Yes. No need to see a doctor all the time, kasi the chances are hindi magpo-progress yung curve niya, and it won't cause her any problem. So, gano'n.
Yeah, so many people I know who have had or been diagnosed with scoliosis that didn't completely affect them. They just let it go, like me. Never went back to check. And
for example, I'll give you an example. I had a patient earlier this week. She's already 55 years old. Ganon na ganon yung kwento niya. She was diagnosed as a teenager. She doesn't remember ilang degrees yung curve niya nung teenager siya. But napansin lang niya, when she turned 50, she wanted to have a checkup. Napansin niya na parang she's getting shorter.
Yes.
Parang her, again, no, her right side is tilting over the left side. No? So she wanted to have a checkup with me. And when we did x-rays, the curve was already at 65 degrees. No? So malaking-malaki na yung curvature niya. And the thing is, pag ganyan, you have to consider already she's 50, and you ask the patient, is it causing you problems? Because you have to monitor that. It might progress, it might even get worse. No? So that's when it comes to making a decision. We have to do something. No? Kasi we're gonna monitor it. If it progresses over a year, I mean, kung 65 ngayon, next year nasa 67 or 70 already, lumalaki pa. So, kailangan natin gawa ng paraan yan. So
that has happened. You've seen that case where parang wala lang, di ba? Because it, you know.
Right. That's right. So, and then when it's really late already in the game, 50 years old na, then she notices parang tumatabingin na yung katawan niya, there's already body asymmetry, and then we take x-rays, severe na pala yung curve. So that's when we have to do, syempre, sana na-prevent that from happening, sana nagawa ng paraan before. If she needed surgery before, we would have been able to do it at a younger, healthier age. No? So these are things that you really have to think about. No, you just ang talaga importante. You just have to find out what is the degree of your scoliosis. Basically, that's it.
Okay, I think you know, I might have to ask you when you're free after the show, and I should have my scoliosis checked. I mean, so many of us say the same, you know, story about scoliosis. I just happen to know so many people, and like can't do it. Forget it. Let's just do it. You know, when you're a bit like younger, like in your 20s or 30s, you're like, oh, they said I can't go hiking. Who cares? Let's do it. They said I can't run. Well, you're still moving. Do it. And you know, so many misconceptions that we have about this, and the thing is to get it checked and see if it's progressed or what do we need to do about it. And also, you know, you mentioned that the shoulder is lowered and all of that. You know, Filipinos have this thing where they say kuba. Okay, is that okay? So I had to bring it up because sasabihin, kuba kasi yan, pero may scoliosis. What is the difference between a humpback, or is that a proper, I'm sorry, term, or kuba, you know? I mean, something, you know.
Kapag kuba, when we're talking about kuba, we call it kyphosis. So it's called kyphosis, meaning when you look at the side of the patient, bend forward yung trunk niya. May trunk forward flexion siya. And that's usually, again, maraming ibang types of kyphosis yan. There's also a genetic type of kyphosis. It's called 𝗠𝗸𝗁 na yung shape talaga ng buto ay nagwe-wedge from the beginning, from a very early age. So it leads the child or the teen to really be more kuba than most kids, no? There's also age or degenerative kyphosis. Again, no? Nakita natin yung mga lola, yung mga 85, 90 years old na kubang-kuba sila. This is usually from age-related changes of the spine na yung normal square shape because nagiging osteoporotic or very malambot yung buto, no? Due to weight and overuse and over time, nagiging wedge shape yung mga small bones niya. So if you combine all that wedges instead of squares that make up the spine, no, yung cube-like structure ng mga vertebral bodies, nagiging generally kuba na yung lola. So it's because of osteoporosis, osteoporotic changes. So that's very different. So kyphosis is flexing forward, scoliosis is bending sideward.
Okay. And then I've also heard of cases, I think I know 2 or 3 people they say, oh, your posture, since you were, parang it's too straight, parang it's almost going backward. Then it hurts their neck. Is there a term for that? Or they have to like hold their neck up, or, you know, because it's too straight down, na parang bumaliktad. Parang naging ganun.
Meron naman kaming tinatawag na, it's called sagittal imbalance, meaning yung head ng pasyente from the side, it's not right center on the pinaka-sacrum. Dapat may ano yan dapat center yan So parang yung center weight ng body, balance yan. If the head is too forward, that means that either the spine is bending forward so much or masyadong flat or masyadong lordotic. Sabihin, imbis na kulang yung kuba niya, sobra na bang flat niya. No?
Sobra.
Parang may flat back syndrome siya na tinatawag. So,
Okay.
it's really all about balancing, no, the location of the head in relation to the hips and also the center of the weight of the body.
Yes,
So-
you mentioned that. Sorry, go ahead, doctor.
Yeah. So, I was gonna say, may mga pasyente naman na pareho nandun. May kyphosis na, may scoliosis pa, no? So, bending forward and then turning to the side. So,
Yeah.
really, that's when we say it's a three-dimensional thing.
Yeah.
So, you can imagine the spine can go anywhere, no?
Yes. Forward, back at the same time, side.
Forward, backward, and then pwedeng mag-twist pa, mag-rotate pa. So, these are the things that we see, no? In the clinic.
And doctor, usually when we see like the lolas who are bent over or nakukuba, a lot of people will say, kasi nagbuhat yan ng bigas nung bata siya. Like sako ng bigas. Or is that related
Yeah.
to I mean, because of hard labor, physical labor. There have, you know.
There is very, very, very poor correlation between lifting sako ng bigas and as you get older, nagiging kuba or nagkaka-kyphosis siya.
Okay.
It's very hard to find the relation.
Yes.
Not really. Yes.
That's-
Even for kids carrying back,
Yeah,
diba, may sinasabi rin na yung mga bata, dapat hindi masyadong mabigat yung likod kasi baka magka-scoliosis yung kid. That's also not true. It's also a little bit controversial. Hindi scoliosis ang result ng mabigat na bag. Back pain. Back pain ang lalabas. So hindi magdi-deform yung spine mo. The spine is, if there's no scoliosis, if it's a normal balanced spine, just because you're carrying a heavy bag, it doesn't mean you will have scoliosis eventually.
will not cause scoliosis. Yeah, I know. I was told not to carry a backpack, and I was like, I need to, because I was.
Hindi din. So again, it's those advice, those pieces of wisdom are there to prevent really back pain, no? Para hindi sumakit yung likod. The Pediatric Society, they agreed upon, or even us in the Spine Society, we agreed upon na parang yung tama lang na bigat ng bag ng kids na when they go to school, dapat not more than 10% of their body weight. No? And then they shouldn't really, kasi uso yung one strap nila. Diba?
Yeah. No, I used to.
Yan. So, good for you. So, dapat dina-double strap para balance yung weight. At the same time, again, not more than 10% of the body weight. Distribute. Huwag mo ilagay lahat sa isang bag yung paunan, yung laptop or yung device, tas lahat ng books. You have to distribute, no? Separate the lunch in the one hand and then the books in the other. So, balance dapat lahat yung karga ng kids, no? So, but again, it doesn't necessarily mean na kung mabigat yung dala ng bata o ng magkakascoliosis siya. So, not necessarily the case.
And if you already have scoliosis, what you're trying to avoid, it's still back pain that you're trying to avoid. It doesn't necessarily mean that it will make your scoliosis worse if you use a backpack.
That's right.
Okay. So,
Not necessarily.
Si Doc, tama pala ako tsaka yung mga katulad ko na sabi na, ba't ang dami-dami mong dalang bag? Kasi pag dito lang, mabigat. it's
Tama yun. Tsaka dinouble strap mo. Tsaka hiking ka. So
double strap and then there's one more bag, or if you go to the office, I'm gonna put the heavy books and distribute it. So okay, that's, you keep making fun of us, but we're actually doing something good.
Tama. That's right, diba? Tsaka yung uso sa atin dati, yung stroller, diba? Yung imbis na bag, ilalagay yung stroller. So,
I like that.
So
What do you think? It's better.
We can correct.
Yeah. Nasira yung gulong ng stroller. I love that. Sometimes when I had sometimes I go around with a small maleta because it has legs. Yeah. I don't want to carry that.
Four wheel.
Yeah. Yes, the four wheel. It's where are you going? People will tease me. You're going on a trip. Yeah. Basta as long as my back doesn't hurt. So okay.
That's great. That's good.
Uso yung bag na may stroller. Tapos parang di na nauso, no?
That's right.
But those are actually probably better. Okay. Doctor, we have, before we continue, You mentioned the hips. I know someone, and when she was younger, she never really got it checked, but you could tell already. And they made fun of her and they called her baluktot, So at this age, it's probably I know she has a lot of pain because that's it. So if you can, the scoliosis also affect like parang one hip seems lower than the other, or that kind of thing. Parang you have an imbalance in your hips and your, like when you're
or it could be the other way. That's right. It could be the other way around. It could be that there might be something wrong with the hip. Diba? It might be a hip pathology or a limb length discrepancy. Sabihin yung isang leg niya shorter than the other, which causes the pelvis to tilt. Diba? So, para upright pa rin siya, ang gagawin niya, compensate yung spine. So, it looks like may scoliosis, pero actually wala. It's not the spine that's crooked. It's more of the hip is actually either undeveloped on one side, what we call dysplasia, or baka may limb length discrepancy siya sa legs, mas maiksi yung isa. So, yung pelvis niya o yung balakang niya, tabingi, so para upright pa rin yung ulo, nagko-curve yung spine. So yun yung tinatawag namin na, that's right, yun yung mga tinatawag namin na non-structural scoliosis, na hindi naman yung spine yung talagang may problema, there's something else that's causing the curvature of the spine. So
non-structural kasi it's not the spine that had something in its structure, pero another part of the body that had something that in its structure to compensate. Syempre, we do it unconsciously, di ba? We compensate, we need to stand up straight, stand up. So then something developed and caused the scoliosis.
Right.
Okay, doctor, before we get to how you treat scoliosis, we have a bunch of questions here. Magandang hapon po. This is from Michael A. Manalo. If you slouch often... okay. We have a question. Magandang hapon si Michael Manalo. Magandang hapon din sa'yo, Michael. Thank you for tuning in. No? And then we have a question from Anthony Garcia. If you slouch often while sitting down, are you prone to scoliosis?
Again, it's not going to lead to scoliosis. It's going to lead to back pain. Definitely. No?
Okay.
Sasakit yung likod mo. So,
yeah. Thank you for that question, Anthony Garcia. And from Alana, what's the best exercise, doc, to prevent scoliosis? Is there any?
Okay, that question. To prevent scoliosis, you mean prevent it from getting worse? In other words, no? Is there any? I'll try and classify it or rephrase the question. Is there any exercises that you can do to prevent the scoliosis from getting worse? Right. So there is usually normal physical therapy, basta yung core strengthening exercises, making sure the muscles are well conditioned, the muscles are strong. These are exercises that actually strengthen the core, the muscles surrounding the spine. So that can help, no? Prevent back pain, prevents back stiffness and all that. There is a type of therapy that they do nowadays. It's called the 𝗥𝗲𝗽𝗋 method of physical therapy, 𝗥𝗲𝗃. No? What it does is it targets specifically the different curves, the lower thoracic and the lumbar thoracic. Their exercises. If you go to the therapy room, parang puro bars yan on the walls. And then what they do is you hang on these bars, iba-ibang angle ang ginagawa mo. And then may repetitions of bending, no? And what they note is that it's able to actually decrease, no, about 2 to 3 degrees minus from your current curve status. But parang the research has shown na it only works with very small curves, no? Kumbaga, kung mild ang curve mo, nasa 25, 26 degrees lang, o yun, pwede ka mag-Schroth method ng therapy. Mababawasan ng konti, no? You can
have that in Makati Med. You have the.
We have Schroth. We have rehab specialists that are actually trained in Schroth. Also, they are familiar with Schroth, so pwede yun. But again, the Schroth hindi yan for severe cases. Bawa kung malaki na yung curve mo, walang mangyayari. Talagang they're not that effective as well. So it all depends. Again, it's tailored the case-to-case basis pa rin siya.
So Alana, thank you for asking that question. I guess, as doctor said, rephrasing the question, there are some exercises you can do and like this Shroth therapy, but that's only tailored for. I mean, it's best if you're the curvature is slight only, no, the degrees, and maybe I guess Alana, you could just because when it doesn't necessarily mean you will not get scoliosis no matter what you do. There's really nothing you can do to prevent it. Maybe what you can do also is like as you get older and you notice things, have it checked out. I guess di ba
Siguro, what we can prevent, siguro, is the one we're talking about, the degenerative one, the degenerative type. Kasi yon that happens with aging. So I think we have more leeway to prevent that from happening by constant regular exercise, constant core strengthening exercises, lessening the sitting time and all that, staying active and living a healthy lifestyle. These are the things that you can do to prevent the degenerative type, no? Pero sa idiopathic, kapag meron ka ng curve, no, pag maliit lang, it's not gonna progress talaga, I mean, if it's really small, the chances of progression are very, very low. So, like I said, I would tell the patient, huwag ka masyadong mag-worry kung maliit lang yung curve mo. Hindi naman siya lalala.
Okay. Thank you, doctor. There's another question. You popular doctor. It's from Genesis Salazar. If you have scoliosis, does it affect your neck too?
Yes. Again, depends on the kind of scoliosis you have. If the curve is relatively high, and if the curve is medyo mataas sa position ng spine, no? It's a cervicothoracic. Ibig sabihin, yung curve involved yung cervical spine. No? That's one. Or two, it's a severe curve wherein it leads your shoulders to be imbalanced. And for you to want to keep your head upright all the time, mag-a-adjust ka. So that will lead you to have some, again, compensatory, sasakit yung leg. You know what I mean? So that can affect the neck muscles as well. So it's all about the degree of curvature talaga.
Thank you for that. Thank you for answering that question, doctor, from Genesis Salazar. Ina? Yes, Ina saying hello. Hi, Nicole and Doc, watching you guys from Hawaii. Thank you, Ina. Wow, what time is it there? And it's the day before there.
Oh, Hawaii.
Yeah. From U1 John, what age do you get scoliosis? I guess you can maybe just recap that, doctor.
There's a type of scoliosis called congenital. I know we haven't mentioned that yet. No? Congenital scoliosis means your spine wasn't able to form correctly. So at birth, meron na siya. Diba? Kasi yung buto ng isang part of the spine is not square. It's actually wedge shape or basta may abnormal formation. So congenital scoliosis, you have that right at birth. The idiopathic type of scoliosis, it can be juvenile, meaning school age. Sabihin, age 6 pa lang, may konting curve na yung kid, pwede yun. Or mga age 8, 9 years old, ganon. Or after that, mga 9 to 10 years old, you can see nagko-curve na rin siya. So you can start very, very young, no? Kahit school age, around the age of 6. That's why one of our advocacies we want to do is we want to bring back what we call school screening, scoliosis school screening, no? We'll take a day for the kids, no, to just come in, and then we do the forward bending test. We see kung may asymmetry or not. And then kung meron, we take x-rays, right? And then we can determine the curve already. So at least screening pa lang, nalalaman mo na yung mga kids na may potentially can have big curves in the future that need intervention, na parang pwede na tayo mag-start ng bracing at a very early age, or we can prevent the curves from getting very severe, no, when they get older. So it can start very early. It can also start sometimes pag puberty na, no? Usually the age of 11 or 12 years old. Sometimes doon nagsisimula. Pag nag-growth spurt, doon nagkaka-curve. So minsan ganun din. So it all really depends. The degenerative, of course, like we mentioned earlier, sa mga matatanda, no? So nasa mga 50s, 60s, 70s, ganun siya.
So basically, Yeah, it can hit us at any time. I mean, it can start when you're still in the womb. So, I
Yeah,
mean,
the congenital type, pwedeng ganon.
then any
The
age.
idiopathic type, a little older.
Moving
That's
forward.
right.
So thank you, Doctor, for answering you and John's question. And then we have a hello, hi, Nick and Doc, watching you from Sedona, Arizona, Christina. Thank you, Christina. All right. I'm glad to see that night owls in other parts of the world are tuned in. And please watch us over and over again on YouTube of Radio Bandido or Facebook. You know, it's always good to view the shows and get hear the information again and again from the doctor. Okay, so doctor, let's get down to it. How do you treat scoliosis? Because you've talked about the progression, or maybe some of the risk factors first. You mentioned some of them, but if you'd like to circle back to them, the risk factors for getting scoliosis and what are the treatment options available for scoliosis, and particularly those that you apply.
So I'm sorry, but again, we have to, the answer to the question has to, again, separately deal with either idiopathic or degenerative. So iba yung principles of treatment.
Okay.
So for idiopathic, again, you want to prevent curve progression, and you have to determine if the curve will progress or not. No, so we classify curves as either mild, moderate, or severe. So anything less than 25 degrees, they are classified as mild. And when we say mild, the chances of this progressing pa are very, very low. So the treatment for very mild curves are usually just observation. In other words, babantayan lang natin yung kids with mild curves as they go along. If they have a curve of 25 degrees, yung sakto, 25 degrees at a very early age, so age is very age dependent, no? Sometimes it's good to observe them as they get older. If it progresses, halimbawa, in a span of 6 months from 25 ng 30, no? So any degree of 5 degrees within the 6 months progression, these are the ones already that we know, kahit they start small, ang bilis ng progression niya, we have to treat this already with a brace.
Okay, a brace. Okay.
So that's when bracing comes along.
Is this considered moderate? Or
this
still?
is for moderate curves, which are 25 to 40 above, no? So curves for moderate, they are treated with bracing. Now, the thing with bracing is, the common question I get with bracing is, when do you start bracing? When can you brace? And when does bracing become not really very useful? No?
Yes.
So bracing is there while the child is growing up and reaching skeletal maturity. No? That is a very important thing to remember. Kasi I get patients who are already 18 years old and they think, pwede pong i-brace to. But 18 years old, konti na lang yung tatangkad, yung growth potential niya. Bracing is likened to, you have a small tree that is growing and you want to ikakalang mo yung curves ng tree para ang tubo ng puno diretso, right? So that's what the bracing is going to do. It's going to guide the growth of the child as they grow, and then through that growth spurt, yung biglang tangkad niya, ang gusto natin yung growth spurt diretso, hindi growth spurt pakurba, right?
That's
so as they reach skeletal maturity, by that time na nasa 16, 17, 18 years old na sila, yung curve na dating malaki, either na-reduce or na-maintain na, o kung maliit before, na-maintain siyang small curve lang. So that is the thing about bracing. Disadvantages of bracing is, number one, of course, the discomfort. The bracing is advised to be worn at least 24 hours a day. No? So night and day yan, matutulog or whatever. Minimum sa amin is actually 16 hours yan.
Okay.
Latest research has shown na kahit 13 hours, kumbaga tawad na tayo. 13 hours a day, pwede na magiging effective pa rin yung brace treatment. But syempre, as spine specialist, the more you use it, the better, mas effective sa kanya, right? So this is the rigid bracing. Now, pag severe naman ang curve, for example, very young pero severe naman yung curve, may role pa din yung bracing. But the bracing is to prevent it na from getting worse, no? Kumbaga, kung nasa 50 degrees na, pero bata pa, very young pa, flexible pa yung curve, there's a chance na it might get less or it might just not get worse. So that when we reach maturity, pwede nang operahan.
Okay.
You see? So ganon.
Just to recap, doctor, when it's mild, when we're talking about idiopathic scoliosis, when it's mild, that would be anything less than 25%, the curve.
25 degrees, that's right.
Sorry, 25 degrees. There's not much you have to do except monitor to see if it's getting worse. Again, if you have moderate, which is 25 to 40 degrees, it's bracing, and we all know that bracing is when you put the braces, and often you see it in some of us have not. If you haven't seen an actual person with a brace, sometimes you see it in the movies where a kid is wearing a brace and they make fun of the kid because they have a brace. Up to from the age of elementary school to high school, you get that image. It's in pop culture. So basically, the brace is there to help. Your analogy was great. And when you plant a tree and it's starting to go crooked, or even any kind of small plant, you can put wood.
I'll give you an update. Yeah. That's
Sorry,
right.
go ahead.
I'll give you a small update. Sorry. The brace now that we use nowadays is thermoplastic, and it's contoured to the body. So hindi parang dati na nasa labas. This one, you can wear it under your shirt and hindi halata. You won't even know that the kid has a brace on.
Yeah, so that's better. And it's also more attached to the body. Yeah.
Saka hindi na ganun kainit. It's very porous. So these are the new materials that we can use now. Kasi the pinaka-difficulty with telling a child to wear a brace is syempre compliance, no? Ang hirap sabihan ng bata na suotin natin ng most of the day. So these brace makers were able to develop talagang yung mas komportable na brace, mas low profile, hindi kita, and then it's more comfortable. Their areas where are exposed are open, so that hindi naman buong trunk area sikip na sikip siya, no? And then these are adjustable. As they get older, na-adjust siya ng may Velcro, and then may refitting again and all that stuff. So I just wanted to point that out. Yeah, when you mentioned earlier na nakakaya, na nire-ridicule. Nowadays, hindi na yun. So it's under the shirt, under the clothes and all that. It's hardly noticeable.
And it's also more comfortable. I would imagine, because if you have to sleep with it also, it's better to sleep with it. You would want to remove it at some point, if it's there's something there that that's on your body when you turn. So that's so great, doctor. And you have this in Makati Med. You have the new type of braces, the bracing for the back.
Yeah.
Okay. And as you said, even the materials, it's not so hot. And there's Velcro. So actually,
very lightweight na rin siya.
Parang you're wearing second skin, or or a bra, something. A bra for your back. You wouldn't know about that. I would think it's something like that. You kind of forget it's there. So that's great to hear about bracing. And you were just saying bracing, of course, as a spine specialist, you would really want the patient to wear 24 hours a day, because that's best. It can have the best effect. It's like, and then if not, sabi mo, pwedeng tumawad pa ng 16 hours a day. And then there are some studies that show 13 hours, sige, okay. But syempre, as a spine specialist, you would recommend really 24 hours a day. And it's,
that's right.
You explained it, you like it, the analogy was so good. Even when there's a plant that's not growing straight, you put, I don't know, any type of wood, bamboo pieces beside it, and you kind of tie it, and it kind of guides it to grow up straight. So that's what it does. Now, doctor, when it comes to severe, what's the treatment for severe?
So for severe scoliosis, and then the for example, the bracing didn't work. The child is grown already into, let's say, 16, 17 years old, skeletal maturity already, no? Kulang na lang, konti na lang yung tangkad niya. And it's at 45, 50 degrees.
Mhm.
too old na for bracing, no? So too old na for bracing, and because it's at a severe degree, we know that as they'll get older pa, kahit mag 30-year-old yan, maglalala yung curve niya, then we'll have to do surgery already. No? Surgery na yung treatment for that. And the thing to remember is the surgery, again, is there. Hindi namin goal going zero, yung going completely straight, yung spine. Kasi some patients, they have that expectation na parang, uy, gagawin mong diretso yung spine. Of course, we will try and much as possible to correct, get the maximum amount of correction that we can, which is still healthy on the spinal cord and all that. But the goal is really more of to stop the progression. No? We don't want it. We don't have to worry about your spine, and we don't want to worry about your spine anymore getting worse, getting more crooked as you get older. So yun yung goal ng surgery natin.
Can we talk about the surgery a bit, Doc? Like, what exactly do you do during the surgery?
The surgery is called a posterior spinal fusion. What we do is we approach. It's like putting an internal brace. No? Parang ganon. Remember the discussion earlier, yung C-curve, part of the spine na may curvature, no? So yung C-curve na yan, gusto natin going diretso, right? So what happens is we put screws all over that part of the spine that has a C, and then we put rods that are curved this way as well, di ba?
Okay.
And then when the rods are fastened to the screws like this, no? A little bit graphic, but what we do inside the operation is we rotate the rods within the screw. So ang nangyayari, yung rod gumiging ganito.
Okay, I see. Okay, so you're straightening it using the rod.
So what you're left with is actually already a straight spine. Diretso na yung spine mo, and then bumalik yung curve sa upper back. So nadidiretso yung spine natin. And sometimes if the spine is very, very flexible still, sumusunod siya sa rod, no? Pag diretso mo yung rod, magiging diretso. Sometimes, hindi na ganun ka-flexible. This is for older patients na medyo mas rigid na yung likod nila. But at least, pag yung part ng C na yun ay nadiretso na, and then we put the rods, and then we put screws already, that's what we call a fusion. That part of the spine that is a C, hindi na siya gagalaw, hindi na siya ka-curve.
It won't get worse.
Fused. Yeah, solid na siya. So,
and you leave the rods in, no?
Yes. You leave the screws and the rods in already. That's right.
What material do you use for the rods and the screws?
The rods and the screws are classically titanium, meaning they're bio-inert. No? They don't give any bad reaction to the body. They're built and designed there talaga to be there for the rest of your life. Parang ganun. In some countries where healthcare is subsidized, in other words, libre lahat, some patients, just for peace of mind, they have it removed. So, pwede rin pinatatanggal, pero that's another surgery. I mean, why would you want to have another surgery?
Like when it's straightened already, they have it removed.
Yeah, when it's completely fused na and the bone is already solidified, they have it removed. But sa atin, in our setting, it's not necessary.
Yes. Did you use steel for that? Did you use steel or any? What material did they use when they started this surgery?
Long time ago, they started, I think, with stainless steel, with steel. But the thing is, yun nga, hindi pangit ang nagre-react. Merong metallurgical reaction to the body. Minsan hindi, something with the elasticity of the steel as well. Hindi rin maganda yung kapit sa screw sa bones. We didn't have screws before, Dati wires lang ang ginagamit. Dati isang side lang nilalagyan ng rod kasi nga iba-iba. The evolution of the surgical technique has come far from how we used to do it before.
And now it's much better. Okay, so with the degenerative, doctor, basically what do you do? How do you the degenerative you're talking about with scoliosis, do you treat it the same way, like try to manage it first without the surgery, and then if surgery is necessary, do you do that?
So sa degenerative naman, mas common sa degenerative din yung common din sa degenerative yung walang nararamdaman, you see.
Okay.
So there are patients with degenerative scoliosis na okay, humina yung likod, hindi na maintain yung yung straight na shape, no, nagkaroon ng curve yung spine nila, most patients won't feel anything, no? Walang problema. But the patients that do, they usually have back pain because of instability. Minsan kasi yung alignment ng mga small bones along the curve, nagdudulasan sila, nawawala sa alignment. That can cause some back pain. We mentioned earlier na because the discs are already degenerated as well, flat sila, nagkakaroon tayo ng slip discs or disc herniations that can cause nerve compression. So may scoliosis na walang back pain pero may sciatica naman sila, may leg pain naman sila. So, which is a common symptom with sciatica, with slip disc, no, or disc herniations, ganyan. So, the approach for degenerative scoliosis is really more on what the patient is feeling, no? Hindi na yung ayaw natin mag-progress yung curve, although nagpo-progress sila sometimes, but it's more of ano yung complaint ng pasyente.
So,
Kung masakit yung likod, yeah, we treat the symptoms. If the problem is the back pain and it's being caused by the instability or the severity of the scoliosis, then we have to do something with the instability. So, maglalagay tayo ng implants again, same, screws and rods and all that. Or we actually do a trial of physical therapy first. Baka naman pag napalakas yung likod, yung muscles, mawawala yung back pain. So, conservative measures muna. Also for slip discs with scoliosis, kapag may sciatica, therapy din munang trial natin. Yeah. So very, very different approach, no? But again, the goal is not to prevent the curve from progressing. The goal naman is to make the patient comfortable. Kumbaga tatanggalin mo yung symptoms niya. That's right.
And have a good quality of life. No?
Exactly. Quality of life ang habol natin.
Doctor, we're actually out of time. I wish we could talk more. Maybe I'll visit you in your clinic. Give me your number after the
yeah, sure, anytime. We'll get the next day.
Do you have any final words you'd like to tell people about reducing the risk of scoliosis or posture? You mentioned that earlier. Anything like that. Just whatever it is, you have the floor.
Siguro one of the things that I always get asked when I know is, number one is the relation between pain and the scoliosis. It doesn't always happen. It doesn't always follow. Now, when you have scoliosis, you have pain. That's one. Pain is really more commonly because of muscle strain from the back muscles talaga. And this happens when, again, it's lifestyle talaga. I always emphasize this to my patients. It's when you sit for a prolonged period of time. Almost anybody, when they sit longer an hour, they start to bend forward and crouch, or slouch, parang ganyan.
Yes.
But it's actually giving more tension on the lower back and giving you more problems in the long run. And that's how, if you live a life like that of sedentary lifestyle na laging nakaupo, laging kulang sa exercise, you don't stay active, that's what can lead to eventually, not all the time, but I'm saying it can lead to degenerative scoliosis as well, or in general degenerative problems. So, as advice talaga is just sit less, move more, stay active. If you do have scoliosis, don't worry about it so much. The small degrees, the small curves don't really progress much. If you're worried that your curves are big, let's get an X-ray. Let's make sure na hindi siya magpo-progress anymore. There are many ways to treat. We can do therapy first. Wag matakot masyado sa surgery. It's done more often now than before, and it's safer now. Before, we have all kinds of new instrumentation for monitoring your spinal cord while we do the surgery and all that. So, dami ng advances talaga. And of course, Makati Med offers all of that. So yeah, there you go.
Thank you, doctor. That was great. And I was so enlightened by the show. I will ask for your office number or your number because yes, it's time to do that. So all my friends who watched, we can argue about other things with scoliosis now and what we can and can't do. Anyway, folks, thank you for tuning in. Thank you to AJ, the technician, and the people at DZRJ Radio Bandido. And thank you to Makati Med. Thank you to you, Dr. Canto. I will see you in person.
Thank you, Nicole. Thank you, everybody.
Okay.
Yes,
take care, everybody.
All right.
Okay, see you next week, Mondays.
Thank you.
5:30. Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.